Hello and welcome to another in the series of interviews with officers of the British Cardiovascular Society. My name is Dr Andrew Flett. I work at the Heart Hospital in London, and today I'm interviewing Dr Bernard Prendergast from the John Radcliffe Hospital. Hello, welcome Bernard. Could I just ask my first question, which is what was it that first attracted you into medicine and then into cardiology?
Well, that's a good question, of course, and it seems a long time ago now, but my recollection is that I wasn't really quite sure what to do when I left school until I actually had to complete my UCA form, as it was called in those days, to fill out a place for application to university. But I'd always enjoyed science at school. I was probably best at mathematics rather than biology, but medicine seemed like an attractive career in terms of the combination of the science theory together with its practice, and of course the rather predictable line about doing something that helps people along the way as well. So medicine always seemed like an attractive career, and certainly that's proved to be the case because I've enjoyed my career immensely and have never regretted my decision. With regard to cardiology, in many ways I think I was a victim of circumstance. So my first house officer jobs were with the professors of cardiology in Nottingham, where I was a medical student, and I was very privileged to work under John Hampton and Tony Mitchell, who were the foundation professors of medicine in Nottingham and had a very strong cardiovascular speciality within the university hospital. So they were inspirational people to me when I was a junior doctor. And thereafter, I became an SHO in general medicine, and my first job in general medicine was as a cardiology SHO, working on the Wessex Cardiothoracic Unit in Southampton, where amongst others I worked with Keith Dawkins, Hugh and Gray and Ian Simpson, who were clearly very strong role models to follow. At that stage I wasn't sure whether I still wanted to be a cardiologist, so I was a general medical registrar. But fate again played its hand because I ended up working for professors of cardiovascular pharmacology in Southampton, notably Professor Charles George, who went on to be the lead author of the BNF, amongst other things. So there very much was a sense of destiny that cardiology was meant to be. And eventually I chose it as a speciality, and also continued to work under several inspirational cardiologists in Cardiff, Roger Hall and Andrew Henderson. A.J. Shah was my academic supervisor during my MD, and subsequently in Edinburgh, Paris, and eventually qualifying to be a consultant.
And can you tell me more about your current job at the John Radcliffe?
So in Oxford I have a rather diverse portfolio, I think it's fair to say. I'm unashamedly a general cardiologist, but I'm a trained interventional cardiologist as well. And over several years as a consultant, I've maintained a high volume angioplasty practice, both for elective and acute manifestations of coronary disease. But going back to my training, I always was under the mentorship of cardiologists with an interest in valve disease. So I've maintained a strong clinical interest in valvular heart disease and infective endocarditis in parallel to my interventional track. And of course that's come at a timely period of the evolution of valve disease, with the worlds of intervention and valve disease beginning to collide more and more with the advent of transcatheter techniques for the treatment of valve disease.
And how did you first get involved with the British Cardiovascular Society, and what is your current role?
So I've been a member of the Society since I became a cardiology registrar, and the role and the shape of the Society has changed hugely over those well, what is it now, 10 or 15 years. My direct links with the Society arose principally through the affiliated group, the British Cardiovascular Intervention Society, BCS. I was an active member of that society and still am when I was as a trainee and also as a consultant. But for 4 years I was the Honorary Secretary of BCS and very involved in the transition of that society to the shape we see it now under the presidency of Dr Mark de Belder. As an immediate follow-on from being Honorary Secretary of BCS, I was then asked to stand for the position of Honorary Secretary of BCS, and was very flattered and very pleased to take on that role, initially in a shadow role to Dr Charles Knight, my immediate predecessor, and taking on the role in its entirety approximately 1 year ago. The role of the Honorary Secretary is relatively diverse. I think historically it was the number 2 in command to the President, but the structure of the Society has changed slightly in recent years, and now a number of Vice Presidents in specialist roles. So the role of the Honorary Secretary is to be a supportive officer, working closely with the President to deliver various projects that are important to the Society at any one time, but also specifically to coordinate activities in relation to membership, to make sure that the membership is kept informed of the activities of the Society, and also in conjunction with Dr Sarah Clark, who is the Communications and Education Lead, to provide the linkage with other societies and also with the media and the press, which of course is a very important part of our public image. The role of the Society has changed hugely over time, and one would hope, being a flourishing society, that it will continue to evolve. So 10, 12, 15 years ago, there was only the British Cardiovascular Society, and if you wanted to get on in cardiology in the UK, you had to be involved with the BCS and all that it was doing. In a sense, cardiology has become a victim of its own success, because there are now very, very successful major subspecialist organisations. I've already mentioned BCS, but of course there are corresponding organisations for echocardiography, the BSE. There is HRUK, the society that looks after cardiac rhythm disorders, the British Society for Heart Failure, the British Society for Cardiovascular Magnetic Resonance, etc., etc., etc. And all of these societies flourish and have a very active programme of their own. And over the last perhaps 3 to 5 years, it's become very clear that a very important role of the BCS is to be an umbrella organisation that unites these subspecialist organisations and allows them to communicate effectively with each other, and avoiding becoming isolated and over-specialised without reference to the broader church.
So what developments have there been within the press office, which is another of your roles, I believe?
So for some years the Society has had a developing relationship with the mainstream press, both the printed media, the broadsheet and the tabloid news press, but also with the news organisations, the BBC, Sky News and so forth. And this is a relationship that we're very keen to foster, putting the British Cardiovascular Society at the forefront of opinion and commentary on matters relating to the care of patients with cardiovascular disease. So what we have set about in the last 6 months is really creating a structure whereby the Society can provide almost a rapid response unit to the press on any stories emerging in relation to cardiovascular disease. And sometimes this can be simply in terms of providing appropriate background information to journalists who are seeking to write a story about the heart. Journalists very often want some basic information about how the heart works, or some basic biological explanations of disease. We might also be asked to comment on emerging news stories with a cardiovascular emphasis. And of course, there have been some examples of that recently with celebrities and sports stars developing cardiovascular problems. And these, of course, are always very big news stories, and it's important to have appropriate commentary and appropriate expert input into the evolution and the reporting of those stories.
So what's on the horizon for the British Cardiovascular Society? What's coming up?
So the Society remains very active on a number of fronts, and its dynamic turnover and its forward-looking approach, I think, is key to its continued success and indeed its continued survival. That's a very important point. With regard to immediate developments, there are several areas which are a priority at the moment. The first and one of our key missions is education, both for the trainee and for the established specialist. And for many years, the annual scientific conference has been the absolute cornerstone of the Society's annual calendar. And year upon year, we continue to develop the programme and embellish the programme and make it relevant to the practicing clinician, as well as highlighting all the developments in basic, translational and clinical science. Key to that currently is the move towards revalidation exercises, which is being embraced by the entire medical profession. And in the last 2 years or so, we have carefully tuned the programme of the annual conference to match the requirements for revalidation for all specialists. So in a rolling timetable of education over a 5-year cycle, attendance at the annual conference will allow each specialist to complete their revalidation requirements and their CPD certification, which will allow them to register with the relevant Royal College and so forth for their revalidation programme to be completed.
So thank you for taking the time to talk to us today. It's been very interesting to find out a bit more about the BCS.